Yeah. So by way of disclosure, I'm a clinical researcher, and the question is about basic research. I think there's a lot of great work going into better understanding the pathophysiology of joint tissue changes. A lot of wonderful work going on into genomics, epigenetics, proteomics, and metabolomics that I think hopefully ultimately will lead to both a better understanding as to why people develop the disease, but also a marker that we can actually use to modify in clinical trials. Yeah. So most therapy at the moment we're advocating for should focus on the core principles as far as management's concerned. So whilst there's a lot of interest and focus in developing new treatments, I think it's really important we focus on the ones that we have that we know work well, which includes exercise, weight loss, and teaching people about self-management. There are a number of other strategies that are around, but they are still the mainstay of therapy. The new innovations are largely focused in areas both of disease, but also pain modification. For disease modification, there's a number of agents that are currently oftentimes in late-stage development that consist of treatments, sometimes injections into a joint, that will allow us to reconstitute joint tissues. So these would be not only modifying the course of a person's symptom experience, but also modifying the structural changes that occur in disease. In addition, there's a lot of new innovations that are going on looking at modifying pain through different mechanisms. And so for disease modification, there are agents that are targeting genes, stem cells, fibroblast growth factor, and some bone targets as some of the more promising. And for pain, some of the more promising seem to be centered around modifications to nerve growth factor. So the best studies looking at comparing the prevalence between Chinese and people, Caucasians living in Western countries, were done now a few years ago and provide a lot of highlights and differences between Western countries and China. The most important differences are that hip osteoarthritis, as we know it in most Western countries, is much less frequent in China. It doesn't mean that hip osteoarthritis doesn't occur, but it probably happens because of different reasons, whether that be osteonecrosis or avascular necrosis, and also developmental dysplasia. But hip osteoarthritis is much less frequent in China, and there are some reasons as to why that may be the case in terms of more uniform shape of the femoral head, neck, and pelvis. In addition, there are probably some environmental exposures during early childhood, particularly centered around squatting, that may prevent the development of hip osteoarthritis. Hand osteoarthritis is at least in common amongst elderly Chinese as it is amongst Western countries, and appears to occur, interestingly, in both hands. And that may be in part because Chinese are more ambidextrous, meaning they use both hands, whereas in a lot of other Western countries, Westerners tend to be one hand dominant, and the osteoarthritis tends to be more dominant in their dominant hand. Knee osteoarthritis appears to be as common in China as it is in Western countries, although the pattern of osteoarthritis in the knee appears to be a little bit different. There's more lateral tibiofemoral disease and more patellofemoral disease, so joint between the kneecap and the femur, and also in the outside of the joint between the tibia and the femur in China, than it is in Western countries. And some of the theories as to why this may be occurring is in part because of increased physical loads on those joints, but also potentially, and this is more historically, the influence of squatting and positions that people engage in with work that may predispose to those different compartments being involved. But, interestingly, osteoarthritis is at least as common in China as it is in most other Western countries, despite big differences in many demographic risk factors between China and the rest of the world. Our biggest risk factor in Western countries is overweight and obesity, and it's not that not as bad in China as it is in Western countries.